Hello, 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 everybody. Welcome to the Behavioral Health Queen with Dr. TK, your Behavioral Health Talks podcast. Welcome to today's episode. The podcast for today is where we take a look at the real issue behind burnout, inequity, and stagnation in behavioral health and higher education, and prescribe bold systems level solutions. I'm your host, Dr. Teranda Knight. I'm a doctor of behavioral health, integrated behavioral health care leadership, Lean Six Sigma Green Belt certified consultant, coach, educator, and the founder of virtually renowned Consulting Access LLC. Today's episode is entitled Beyond the Individual, Leading Systems, Change in Population Health. And if you've listened to some of my priors, you know in those I have shared some population health information there as well. But here, I want to kind of have this open conversation with you. And let's be honest about it. If we keep treating symptoms without addressing the system, we're not leading, we're just maintaining. And I'm going to keep doing these until I get the support in this arena when it comes to behavioral health and higher education. So come with me. Once again, what is population health? Population health is often misunderstood. It's not just about tracking disease rates or improving access to care. It's about understanding how systems, policies, and environments shape the health of entire populations. In behavioral health and higher education, we often focus on individual resilience. Most of the time, you'll see a lot of therapy, coaching, and wellness apps, and all those things are on an individual basis. It does not address the actual system itself. But what if the real issue isn't the individual and it is really the system? Here's some ways to look at it from a population health lens. First, ask yourself, who is being left behind? What barriers are baked into the policies? And how often do we shift from reactive care to proactive, equitable systems? Now that you see this and you can envision this for yourself, let's take a look at the systemic lens and let's talk about the systems itself. If you're a leader in university or behavioral health settings, ask yourself these things. Are your policies trauma informed? Do your metrics reflect equity or just efficiency? Are you addressing burnout at the root or just offering yoga on Fridays? Well, know this, at Virtually Renowned Consulting Access LLC, I use a framework like Lead, Grow, Impact, and Scale because I've done the research and I want to help leaders identify systemic gaps and implement sustainable, data-driven solutions. Because leadership isn't about putting out fires, it's about redesigning the building so it doesn't keep catching fire in the first place. And know that when you are looking at these strategies and you're not reaching out to me, which is the actual researcher of these ideas and the one that understands these ideas, then trying to attempt what I'm talking about isn't going to come with the outcome it should because you don't even understand the process behind it. Next, when we look at real world application, let's think about this for a second. Here I want to give you an idea or image within your head. So we have a university counseling center that has individuals that's overwhelmed. Crisis visits are up, staff is burnt out, and the initial plan, well, is to hire more counselors. But let's take a minute. Let's pause for a second. So the university mapped the system. Did they really look at the academic pressure, housing insecurity, food access, and faculty-student dynamics? Well, yeah, they did. And here's what they came up with. A cross-departmental initiative that included syllabus redesign, peer support networks, and emergency housing partnerships. Within one semester, crisis visits dropped by 30%. Now, that's population health in action. It's not just about services, it's about smarter systems. Smarter systems help our leaders lead and actually be efficient and effective and feel good at the end of the day, not taking home a lot of things they can project off on other people. Now, how can I help? At Virtually Renowned Consulting Access LLC, I support leaders through these things, and that's my goal, is to use my evidence-based research in which I've devoted time into to be able to be knowledgeable around these factors to actually help. And I've worked in the field, so I get it. The biggest thing we need is needs assessments that cover hidden stressors. So many faculty and staff and individuals in leadership in higher education and in behavioral health tend to have hidden stressors because, hey, we want to know or want people to feel like we're okay, right? Or that we've addressed the things from our past. And many times that's not the case. But also, let's address the hidden stressors within the organization. Next, Lean Six Sigma tools to streamline and improve services. Making sure Lean Six Sigma is in place can definitely help reduce waste within the organization itself and waste for the individual that's in leadership, having to complete projects and various different tasks. The third one is anonymous support platforms for leadership wellness. Now, I'm trying to get out here and build the revenue on my own to save, to invest in creating these platforms that leaders can actually utilize with wellness, but also with the tools I've created with their teams. And then finally, culturally responsive strategies that reflect the lived experiences of the population in your higher education institution area. And guess what? I do it all with one guiding principle. Never feed the beast and never fed the beast. Work hard, stay peaceful. And here's why I utilize that philosophy and principle. First, because I want to encourage those that are currently feeding the beast of overwork, procrastination, overthinking, or just over responding, right? To evaluate those things and see the opportunity to make and drive change that can not just help them, but those that are around them and the system in which they're in. Never fed the beast is for the individuals that work extremely hard every day because they value their health and know how important it is to them to not overthink, not overwork, not overstress in general about the things that is going on around them. But for both of these principles to work hard and stay peaceful. Because identifying toxic people and systems without actually addressing the system that broke them, that's not transformation, that's maintenance. I'm going to say that again in a different way. Because identifying toxic people without addressing the system that broke them, that's not transformation, that's maintenance. We're not about putting actual band-aids on anything, right? We're about actually working to improve the lives of people every day. And that's our goal in the field of healthcare, whether it's behavioral healthcare, physical healthcare, whether you are working with people in a human service related field like in higher education. The things you do revolves around people, right? It is important to the dynamic of working with people. So yeah, go ahead, make sure you follow me on the various different platforms. And yeah, I definitely want to thank you for joining me on today's podcast presentation. Because if you're ready to lead with impact, visit www.virtuallyrenownedconsultingaccessllc.org or connect with me on LinkedIn. And if this episode sparked something in you, share it with your colleagues. Let's build a movement of leaders who don't just survive the system, but change it. And until next time, Let's lead boldly, grow intentionally, never feed the beast, never fed the beast, but work hard and stay peaceful. And remember, check me out on YouTube, TikTok, and Instagram, as well as Facebook as well. And I'll see you guys next time.